Well, good morning. Before we call this morning's meeting to order, I'd like to speak to the board members about our mask situation. And we are not required as board members to wear the mask during the meeting today. And one of the questions, or one of the courtesies to JWB is for today, I intend to take my mask off because I've already spoken to Mr. McCurrick and Beth Houghton just to make sure they're okay, and we have the plexiglass between us. So I'm going to take it off during the board meeting, and then as I walk through the building when the meeting is over, I will put the mask back on. But it's a personal choice, and with that, we'll begin our meeting. And Chief Milliken, would you lead us in the pledge? To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, we have a wonderful way to start our meeting this morning with Linda Leedy introducing, I believe, 3 Cooperman Bogue winners. So, Linda?
Good morning. As you know, the Juvenile Welfare Board honors social service professionals who consistently go above and beyond to put children first. Historically, we have given 4 Kids First Cooperman Bogue awardees a year. This year, because of COVID and the number of selfless frontline social service professionals who really put kids first, we are giving this award to 12 individuals. And today we are honoring 3 of them. First, I would like to introduce Olivia Barkley.
Hi everyone, my name is Olivia Barkley. It was a great honor to receive this award. Thank you. It's something, I go to work every day trying to do my best. And I never think that it's anything award worthy, so thank you very much. And of course, I have wonderful leadership at PEMS. They're very supportive of my sometimes unconventional ways. And I look forward to working with you in Tampa Bay. I do miss my PEMS family. Thank you so much.
Well, and if I may, I have a little summary of Olivia's work. She was a former PEMS navigator with the Home program, and now she continues to passionately serve families with Feeding Tampa Bay. But her ability to build on families' strengths and gain their trust is unmatched, from juveniles in the program to both their parents and grandparents caring for them. She was particularly effective during the pandemic, helping dozens of families apply for federal funds to remain in their homes. When one of her families was served with an eviction notice, Olivia was relentless. With just minutes to spare, she negotiated a guarantee for payment over the phone, stopping the eviction in its tracks with the sheriff's deputy at the door. Congratulations, Olivia, on being nominated and receiving this award. Next, I want to introduce Frida Dixon. Good morning. Frida is a recreation coordinator for the City of Clearwater and oversees after-school and summer programming at the Ross Norton Recreation Center. She is the motivating force that keeps the programs running smoothly at all times. During COVID-19, Frida contacted all of her program parents to offer assistance and see if they were okay. She put her fears aside, coming to the center week after week to put out emergency food and school supplies for children and families in need. And in her supervisor's words, Frida's name literally spells out the importance to the program: friendly, resilient, empathetic, determined, and all heart. Congratulations, Frida.
Thank you all for choosing me. Is a word that the kids use, low key. Low key, that's been my dream to get this award.
Oh.
Making my dreams come true.
Oh, thank you. And finally, I want to introduce Cynthia Smith. Cynthia is a family case manager with Suncoast Center who works with families to rapidly assess, navigate, and prioritize their needs at the United Way Suncoast Campbell Park Resource Center. She is highly skilled and compassionate, offering financial education employment skills, and basic needs assistance. During COVID-19, Cynthia worked tirelessly to provide emergency food relief. All summer long in the extreme Florida heat, Cynthia could be found unloading, sorting, and packaging food to distribute to families in need. Cynthia inspires others with her get the job done attitude, but it is her caring nature that absolutely makes a difference for her families. Congratulations, Cynthia.
Well, a very special thanks to Olivia, Frida, and Cynthia. And I've gotten the instruction that there's a photographer in the lobby waiting to take your picture. So if you're ready, I think the photographer's ready for you in the lobby of our building. Thanks again. All right, let me ask our board to call for a motion to accept the consent agenda items.
So moved.
Thank you, Mr. Ongst. Second, Mr. McCurrick. All in favor?
Aye.
That motion carries. Our action items today, the first is for our board members to select an option for our September trim hearings. And keep in mind, we have 2 trim hearings, so there are 2 dates for each option. And the second item is that our board meeting for the month of September would change to be at 3:30 in the afternoon on the date of the first trim hearing. So as a place to start, rather than have us all discuss our calendar, I'd like to throw out option 1 as a place to start, which would make our board meeting at 3:30 on September 8th. The first trim hearing, September 8th, would commence at 5:15, and the second trim hearing then would be Wednesday, September 22nd. Just a place to start to see if everybody's calendar would suit that option. Okay?
I'm good.
I have an MPO meeting, Forward Pinellas.
Okay.
That's typically not done until 4, so I could come after that.
On which date?
On
September
the,
8th?
September 8th,
Uh-huh. And it doesn't get done until 4?
typically.
Okay. All right.
But I'm fine, otherwise I'll just come when I can.
Everybody else okay?
I have a 3-week jury trial in September, which is probably not going to actually happen, but I have no idea because the Supreme Court has recently gotten very aggressive about you got to try your cases, and so depending on what phase we're in, just plan around me, and I'll be there if I can. So.
But that, I'm assuming what you're saying is that that hearing could really impact more than option 1. It could be.
I can't.
Right.
Exactly. Yeah.
Right,
Yeah.
okay. And at this moment, everyone is here except Judge Moore and Dr. Grego. Dr. Grego usually can make afternoon in this early meeting, yeah. Mr. Bartlett?
My understanding is the important part of it being here for everybody's trimming.
Yes,
Okay.
yes.
5:15 part of it.
Yes, but the board meeting is, we can't conduct business without that quorum. So right now, I hear Commissioner Seal is a definite, probably no for the start of the, where is your meeting? I'm just curious.
Well, it depends.
It rotates? Okay,
We
okay,
may be at the extension still down on Almerton Road, or we could be downtown Clearwater.
okay, all right. Well, I have a feeling that any option we pick, we may have some conflicts, so I guess I'll call for a motion to see if we can go with option 1.
Motion to move forward.
I see Chief Milliken and Mr. McCurrick.
I'm second.
Before we vote, Karen?
May I ask, does that mean the final hearing would be September 22nd?
That's correct.
Okay, thank you. Sorry.
So it would be Wednesday, September 8th, board meeting 3:30, trim at 5:15. Final hearing for trim would be Wednesday, the 22nd. We have a motion and a second. All in favor?
Aye.
Aye. That motion carries. All right. Action item B, which is to approve the budget amendment for expansion of mental health services. Linda, we're back to you, back at the podium.
Well, good morning again, everyone. So given all that has happened during the pandemic, the mental well-being of adults and children in Pinellas County and the nation has been shaken. Kids have seen loved ones get sick and die. They've had to go to school via laptop. Or if they went to school, they had to wear a mask. And they have not been able to have the typical social interactions that they need to develop and grow. JWB heard this real time from our mental health providers when we were conducting initially weekly calls with our funded agencies to check in to see how they were doing, and then ultimately monthly calls to touch base. We heard that telehealth has had a positive uptick, but it doesn't work for everybody, especially the little ones. Therapists need to see them in person, whether it's in the home or in the office or in these socially distant times in a park. But for them, the screen therapy doesn't always have the most effective outcome. Cost of supplies have increased. Agencies need new engagement tools to interact with these kids. You know, they can't use the same clay and the crayons that they used to for the kid that was seen right before them. They need to purchase new ones. Recruitment and retention of clinical staff is particularly difficult. There's a nationwide shortage, and when paid below market rate, staff quickly move on. So Beth reached out to the JWB funded agencies that provide mental health services to children in Pinellas County and asked for a proposal. What could JWB do to assist in getting kids access to timely, high-quality mental health diagnosis and treatment now, this year? How can we help right now? So Directions for Living, Suncoast Center, and PEMS submitted proposals that I can assure you were extensively reviewed by the JWB staff over and over. And then we had subsequent discussions with each agency CEO. Today, I am presenting the JWB staff recommendations for increased funding to these agencies for the remainder of this year, fiscal year 21. These increases are intended to remain in the budget, resulting in an increased allocation for each agency into fiscal year 22. I'm going to briefly share the recommendations for each agency, and then each agency CEO will be given 5 minutes or so to describe the year in the life of their agency throughout COVID-19, and then answer any questions that the board may have. Today, there's actually only one action item, and that is for Directions for Living, as Suncoast Center and PEMS have sufficient laps that will enable them to cover the additional costs for fiscal year 21 of their request. However, we do want to make it clear to the board that each agency would be getting an increase for fiscal year 22 as a result of these recommendations, and that is certainly open for discussion. So after the presentations and Q&A with the CEOs, we will then address that action item. So let me start off with Directions for Living. They are requesting funds, and staff recommends, additional support positions that will enhance care coordination, increases in salaries for 24 clinical positions to market rate, funding for services for which third-party reimbursement is just not available. For example, the psychosocial assessment is what helps the clinician determine what the mental health diagnosis is. And once there's a diagnosis, then often the insurers will pay for services moving forward. But they won't pay for the stuff prior to diagnosis. Another example is place of service. A lot of payers will only pay for in-office treatment. They won't pay for in-home or certainly socially distanced visits in the park. So for the remainder of fiscal year 21, which would be June through September, 4 months, staff are recommending a budget increase for Directions for Living in the amount of $299,277. And this would translate to an annual budget increase in fiscal year '22 in the amount of $735,330. Moving on to Suncoast. Suncoast is requesting funds, and staff recommends additional support positions, including clinical supervisors, that will enhance care coordination and lead to increased job satisfaction of clinicians while reducing burnout and staff turnover. Additional equipment, upgraded Zoom licenses so that their therapy sessions don't automatically end at the 45-minute mark that is within their current license. And additional therapeutic care packages that I mentioned, the clay that the kids use to engage with their therapist in therapy. So for the remainder of fiscal year '21, staff are not recommending a budget increase for Suncoast Center. As I said, the additional cost will be covered by the anticipated lapse amount from their fiscal year '21 expenditures. But the anticipated 4-month cost, we're not asking for additional money because they have it, but the additional 4-month cost is $288,721, which translates to an annual increase for the fiscal year '22 budget of $789,883. PEMS is requesting, and staff recommends, salary increases for 3 positions and 2 additional family connection navigators in 2 middle schools. We currently fund family connection navigators in elementary schools. This would be the first time for middle schools, but it has been requested by the Pinellas County School Board. They did identify Oak Grove Middle and Largo Middle as schools that they really see a need for this service. Additionally, PEMS has requested equipment to support family engagement and it's a one-time expense for items that would allow them to meet families in socially distant places outside, parks, parking lots, as opposed to having to meet inside the home. Again, staff are not recommending a budget increase for PEMS, as the additional cost for these salary increases in equipment is $20,777, and that will be covered by the lapse that is anticipated for fiscal year '21. This increase does translate to an annual increase for the fiscal year '22 budget in the amount of $147,305. Now, PEMS did make some additional requests that staff determined didn't fit into the best initial request for expansion. It was some new programming dollars, so staff are still evaluating that, and we will be back to the board with recommendations on that once we make a final determination. But that wouldn't be until the fiscal year '22 budget. So with that overview and setup, I'd like to ask April Lott, who I know is in the other room, to join us, and she can address the board for a few minutes, and then we'll go to Barbara and then to Maxine. April? She didn't have a seat. She couldn't join the room.
I was at the little kids' table. Good morning. Thank you. Good morning. First, I would just like to say thank you to Beth Houghton for her just belief in community mental health and the need for community mental health and reaching out to all of the contracted providers. I think it's pretty much unheard of for a funder to call providers to say, how can we help? And that was done in this case, and so I'm so grateful for that. I just want to say that the needs of our children are growing exponentially. I know Linda mentioned it in the overview, but I just want to highlight the fact that Medicaid does not pay for services if there is not a diagnosis. And we need to follow the science on what we need to do for our children. And the science is absolutely telling us that trauma to children results in poor health outcomes, whether or not they have a diagnosis or not. And in my opinion, the role of the Juvenile Welfare Board and the funds that we can secure through the Juvenile Welfare Board allows us to serve children prior to there being a diagnosis. And then, of course, once there is a diagnosis, we know that our third-party payers, Medicaid in particular, limits the number of services that we can provide, the types of services that we can provide, and often what the children actually need is an unfunded service. So with these funds, we'll be able to do so much to serve and treat and prevent long-term poor health outcomes for our children. I did review the packet that Eckerd has submitted to you, and I just want everybody to know that we are currently at 100 children being removed. An average of 100 children are being removed in this county every single month due to abuse and neglect. And so we just have to understand that what we know is that trauma certainly from the pandemic and trauma from abuse and neglect is creating problems for our children. And the sooner we can get involved, the better. So I'm just so thankful. I'm so grateful. I just have to say to each and every one of you, literally changing the lives of children, changing the trajectory of the lives of these children. And years from now, 10 years from now, it will be literally because of you and the funds that you are allocating for these services that will mean a difference between graduation and, teen pregnancy. A difference between people going on to become very productive citizens in our community versus sitting in a juvenile detention facility or jail. So I just want to say thank you to each and every one of you. Thank you to Beth. Thank you to your staff who have just been amazing through this entire process. They really put us through it, just so you know. They really put us through it, but they were very good discussions, very healthy and good discussions that made us really think through our requests. I'm happy to take any questions.
Thank you, April.
Thank you.
Welcome, Barbara.
Thank you. Good morning. It's nice to see you all in person. First, I want to thank you all for the opportunity that you afford Suncoast in providing services to the children and families in our community. Behavioral health services are incredibly important, and it is our honor to provide those services. I also, like April, would like to thank the entire JWB team, every single person that we've worked with. You've been phenomenal. You're very collaborative. You really listen to us and understand what our needs are and what the needs of our children and family in our community are. So thank you very much. When COVID arrived, Suncoast Center was a little different than many other organizations across the state and country. We actually had our staff stay in the office and not move to their homes. We did provide the majority of our services via telehealth and telephonic services. However, we did remain available to high-need, high users of services. We still provided services in the office for clients that needed injections. And also, we had our 24/7 completed all our child abuse and sexual abuse exams. And for any clients, we did have a few, mostly elderly, who really just needed to see a person in person. So we were able to accommodate that with all the safety protocols in place. So we are in the process of getting ready to get back out into the area and have clients start to come in, and we're working on all the protocols for that. We're going to be very careful and sensitive, but we know a lot of people really want in-office, in-person services. And we also know a lot of our staff want to provide services. So for a while, our staff have been back in the schools. When the schools allowed us back in, all of our therapists were gleefully back in the schools. We also have been seeing many families, not in their home, but in the community, if they want to choose a park or outside their house. So we had safety protocols, because as was mentioned by April, we are seeing layers and layers and layers of trauma and problems and needs for these families. So it's critically important to get the help that they need to them. We also, during this period, around January time, opened a North County location. Our clients had been requesting that live up in that area for a long, long time. It's at the crossroads of McMullen Booth Road and Enterprise Road. So it's like the Safety Harbor Clearwater area. We're fully staffed up there, although we haven't opened for in-office services yet. So we're very happy to be doing that. we know we have a lot of challenges ahead, and there are a lot of families that need to be served. And so our request is for support services, because we are seeing families, again, that need a lot of extra help. And we want our staff that are in office and our therapists to work at the highest level possible and allow, we want the families to have more support in between those sessions. So we're going to have support staff that are going to make caring phone calls to many of these families to make sure they don't need anything between their sessions. And a lot of all these caring packages we're going to deliver to in-home families as well as families that come in for services. So I just can't tell you how much we appreciate you offering to assist us in these areas, and without you, we wouldn't be able to serve all the families that we do. So thank you very much.
Right. Mr.
Yeah,
Ongst?
so I just had a quick question, and this may be more for Laura. But in terms of the lapse for this year, 288,000 that your lapse is able to cover for the remainder of the fiscal year, do we anticipate that there'll be any significant lapse next year that would potentially cover some of the 789,000? And I guess the same question would go for PEMS, but that was a much smaller number. So what are we looking at, do we think, in terms of real dollars? I hate the budget lapse. I hate the budget money that we anticipate will lapse, is my point.
That's a very good question, and more than likely, we'll take a look at that next year when we, get into that budget. But what we're seeing is the fiscal year 20 was pretty much of an outlier as far as lapses and so forth, so we didn't really want to use that as a guideline. So we looked at historical and looked at the current year projections, and it appears as if we're covered that. I would think that perhaps next year we would be looking at some dollars covering that as well.
Very good, and thank you for the update on North County. That's excellent. I'm so happy to hear that.
Thank
And I know PEMS does a lot of great work in North County as well, so I'm very excited about that because I know that there's need everywhere, but when we allocate these big dollar amounts, I'd like to see some of it spread around to different areas of the county as well. So hopefully some of this money will be going to that center.
Yes,
Excellent, very good.
we have a
That's
lot
great.
of JWB staff that are there.
That's very good to hear. Thank you.
And I do want to kind of address the lapse, and April alluded to it as well. Already, Baycare did a big study on the shortage of behavioral health staff in the area, and in the area that they serve. And before COVID kind of hit, they found that there was a shortage of 213 providers in this area. So we have that to start with. And then when COVID hit, the trend that Suncoast has seen is initially we had a lot of really skilled, tenured therapists, and they were either close to retirement or actually past the age of retirement who chose to retire because of the safety issues. That was a big trend. And then we saw a large number of our therapists move out of state back to where their families lived because their families needed them. And so now the trend we're seeing is we're hiring a lot, so we're advertising nationally, and we're getting a lot of people. We've got some from California, Missouri, Texas, a wide variety of states, and many of them are newer and not as skilled as some of the ones we left, which is disappointing because a lot of wonderful knowledge has left the field from all of these people retiring earlier than they had planned to. But now we're seeing a lot of therapists that are going into private practice because there is such a demand for services. They're going into private practice. So we really can't compete with private practice. They're totally different models. So we believe these support staff that you're hopefully supporting will really give our staff a little more of a breather because they too deal with trauma all day long. So they see clients with traumatic events like hour after hour after hour, and then we had one employee who lost 6 family members to COVID. And so they have their own, like the rest of us, we're all dealing with this. So we're doing everything we can to wrap our arms around them and support them because we know they're key to our community. So thank you.
Thank you, Barbara. All right, thank you.
Good morning. I'm Maxine Booker, CEO of PIMS, and just want to also follow behind April and Barbara and thank you all for just being concerned about the providers reaching out to us and seeing what our needs were and how we could expand the service capacity for the community. When COVID hit, PIMS manages crisis, right? So that's what we do.
But I'm telling you, when COVID hit, that was a crisis like none we had ever seen before. So we were scrambling a bit, trying to get things together as far as upgrading our laptops, getting our agency totally virtual, and our IT took a hit, so we had to make sure that we could get these things done and get them done quickly so that we would have uninterrupted services for the community. We were able to do that. We had to increase upgrade our laptops, increase our cell phone, agency cell phones, increase our licenses because we'd have more people on our virtual networks. So we were scrambling, but we were able to do it. We did have some staffing issues, and we still have some concerns, like Barbara just said. But for those who remained, they have done an excellent job, and they haven't wavered at all. We're seeing our children suffering. We do also operate the Children's Crisis Unit, and those numbers are rising. So with the services that you are offering us today, we would be putting the navigators in the North County schools. And I think those services will help those children with the tardiness that we're seeing, with the attendance issues that we're seeing, and be able to keep them in the community and prevent them, hopefully, from having to come to the crisis unit, because we want to make sure that we are diverting all children away from deeper end services and all adults. We are seeing adults that are coming in as well who are afraid. And with the children and adults, we're seeing more severe depression, anxiety, psychosis, and agitation. So we're seeing the effects of COVID on everyone coming through, as well as our staff. They've had to deal with the emotional toll, but they continue to come to work every day. They've had death of family and friends, some directly and indirectly due to COVID. My father passed in January, and it was indirectly due to COVID, so he never quite recovered after that. So we have had to support them, truly support them. You know, even with the exposures, we've had some positive cases, not very many, which is great. So we've focused on making sure that people are safe when they come in and see us, and making sure that our children are safe out in the community. Our navigators are making sure that they have all the resources they need as well, so we're focusing on that as well. So I really appreciate everything that JWB does for us. And at the beginning, when they were saying we can get through this together, that proved to be very true, because without JWB, without Central Florida, without the CARES funding, without Pinellas County EMS helping us with PPE when we first started, we would have never been able to make it through. We would not be still standing here, I think, if we didn't have everybody providing services for us during that time and the support that we need. So I really appreciate everything that you all are doing. Any questions?
Well, I can't thank you enough. I don't see any lights on. Before we go to the vote, I've already thanked Beth in some of our prior phone calls preparing for today's meeting. I think in this community, there's so many high priority needs, and addressing the needs of mental health, particularly for children, is right at the top of the list. And I think Beth and her team did a fabulous job. Just being creative use of lapsed dollars, creative use of some money that we set aside for the appropriate programming that this community needs. So I just want to thank Beth, the team. I think you heard a little bit of a recurring theme over there that I can see that nothing's changed since I've retired. JWB put you through your paces before there was any movement to bring it to this board. And I remember it well, so I smile a little bit. I see Commissioner Seal.
I didn't have any individual questions, but I did want to ask Laura if you have total funding that we do provide to mental health initiatives for children. Don't need to have it now, but I'd like to see what that is per agency in totality. Also, what about tracking, duplication, and also outcomes? I'm curious about, we really don't oftentimes see that and I'd like to know more about that, please.
I think I can answer some
We
of your
have several agencies that provide these services.
For directions. The increased funding will give them a new allocation for fiscal year '22 of $1,455,102. And directions proposed outcomes are to serve additional children. 40 additional children per month will receive clinical assessment, 120 additional children per quarter for outpatient services, 75 additional children per quarter for intensive case management, 75 additional children per quarter for in-home therapy, and 75 additional children per quarter for team staffings with integrated decision team facilitator, as well as a reduction in the number of children requiring Baker Acts as measured by diversion rates and reduced staff turnover. For Suncoast, the total.
I'm content with receiving that in writing.
Okay.
It's a little bit easier to discern.
Okay.
Thank you.
Mr. McCurrick?
This is not a question about the proposal. This is more of, I think, Barbara, you mentioned that Baycare did a study and showed 221 or plus number of negative needs. I just saw that Baycare has started a program for, I want to call it training, it's residency within Baycare, starting at Morton Plant and moving on. Do you see that as, and I'll ask all three, do you see it as a positive or a negative impact to what you're trying to do by increasing staff?
Positive, I see it as a positive. Yeah, very positive.
Will that roll over to you, or is it that they'll?
We work very closely with Baycare, and it's a psychiatric residency, and we're always in need of psychiatrists and APRNs, so, yes.
And what about the schools like USF, St. Pete, and others that are still in process of training and educating those on there? Are there relationships there as well to try to help keep those students here?
Yeah, we have all relationships with all of them. All of us reached out to all the universities to see who was coming up, and we all do residencies and internships to bring therapists up through the ranks.
Okay. Yeah, I only just recently have heard about, students that are really beginning to look for as they're coming to the end, getting ready to graduate, and it's a perfect timing, I think, for those. Okay, thank you.
Then I see no other lights. I will call for a motion. That's action item 4B on the agenda, to approve the budget amendment for expansion of mental health services.
I motion to approve.
I hear a motion. I see a second. Thank you, Ms. Mallow. And all in favor? Aye. That motion carries. Very nice. Thank you. Thank you so much. Appreciate being here today. All right, action item C. I see Laura Peel is at the podium. We often don't see Laura Peel at the podium, but we all know how hard she works behind the scenes to keep all the technology going. So thanks, Laura. You're going to talk to us about the 3-year contract for Rubric, which is the JWB backup management system.
Yes, exactly. Good morning, everybody. And I've been up here a couple of times over the years, so, but I'm glad to be back. This morning, I'm here to ask for a approval for a 3-year contract through CDWG for a new backup system, as Susan mentioned, we're looking at Rubric. And the request is for $185,538. We work cooperatively with BTS on this selection. As you probably know, they provide our infrastructure support, and so we work tightly with them to come up with Rubric as the solution. It was recommended for several reasons, and a lot are outlined in your memo, but I'll go through the top ones. First off, the county is also moving to the Rubric solution and has the ability to fully support it. It also is a single vendor solution. It offers a full backup to Office 365, in which, with the pandemic, JWB had to move quickly to, and this will provide a full backup solution for that. As far as disaster recovery, it's really going to put us to the next level where we'll be able to grab data that will be stored up in the AWS or Amazon Web Services and spin up servers quickly and provide the data that we'll need to our employees in the case of disaster happening here in JWB, or in Pinellas County, I should say. And one of the biggest advantages is that they provide a hardware refresh after 3 years. So we looked at 3 different quotes when looking at rubric system. And CDW, which is our VAR, value-added reseller, came in the cheapest, but they also allow us the ability to piggyback off an Omnia contract, which Pinellas County also uses. And so that made it a little easy as far as the solicitation piece. So without giving you too much more detail, I'll open it up to any questions you may have.
Chief Milliken?
So just a question here is, how many places does this back up to? So for instance, with us and our inspection software backs up to 6 different locations. How does this software work in that manner?
So we're going to back up to the PSC down on Almerton Road. We have servers over there that we'll back up to. And then the BTS has a secondary location up in, I believe it's Palm Harbor or North Clearwater. And then it's also going to go up to the web, up to the Amazon Web Services. So we'll be able to, it feels very secure as far as our backup systems.
Thank you. I was just concerned that, obviously ransomware is a very real thing going on right now. And after just a little class I took on it, like I saw school systems that were shut down and they didn't have backups to go back in there and get to it. And I just want to make sure we're secure, and in the event that happens, we have the ability to go to different servers to come back at it. Thank you.
Yeah, exactly, because what they'll do is the bad guys will actually destroy your backups. So to have multiple layers of backups is very important, in particular for that. Anybody else?
Seeing no lights? Move, thank you, Mr. Ongst. Second?
Second.
I see that. Mr. Chief Milliken, and all in favor? Aye. That motion carries.
Thank you.
All right, we
Madam-
are
Madam Chair?
about to hear our presentation that we've been, I'm sorry.
I'm
Laura?
sorry, Madam Chair, I just wanted to respond to Commissioner Sale's question on how much money we have budgeted for mental health. And in our current fiscal '21 budget, it's $8.9 million. Sorry.
That's okay, thank you. This is a presentation, I don't know about you, but I've been waiting for. It is the presentation on our early childhood development strategic plan area. And I'm welcoming Barbara Morrison Rodriguez to the podium. And I know there's been quite a bit of work going on behind the scenes. And we welcome you to the podium and welcome this presentation.
Thank you. Okay, I am going to update you on what we've been able to do essentially over the last 4 months, but building on a very big base that JWB already has in the 0 to 3 area. I think you'll see that some of it is a matter of perspective. So, our overall strategic goal, as you might remember, is children 0 to 3 will meet appropriate physical, social, emotional, cognitive, and developmental milestones. Okay. The content of this presentation is organized by strategic objectives to align reported programming and activities with the strategic objective they are designed to implement. We created a 0 to 3 think tank in January of '21 to assemble experts in the area of early childhood education and development, especially with the focus on children 0 to 3, to guide and inform JWB's decisions and strategies to build out the new early child development 0 to 3 result area. And in your board packet, you have a list of the membership of that think tank. So if you want to refer to that, it's a very distinguished group of people. We meet on a quarterly basis. They're very enthusiastic, and I am delighted to have them as colleagues. There are 3 subgroups, and the titles pretty much indicate the content or focus area. There's public policy, research and emerging trends, strategy development and implementation, and outcomes and evaluation. And again, in your packet, you have a functional description of each. Very briefly, the Public Policy Committee keeps us informed of public policy initiatives at the federal, state, and county level that impact children 0 to 3 and related services. Research and emerging trends is to both bring to the attention of the think tank relevant research, but also we entertain requests from them. If there's an area that they want researched, then we pull that together and make some analysis and recommendations. Strategy development and implementation, as it states, is to help JWB figure out action steps and strategies and staffing and funding for the implementation in this area. And then outcomes and evaluation help us to look at outcomes, how well we're doing on the outcomes, and where we may need to turn the curve to do better. Later in the presentation, I am going to give you a slide on what I think the evaluation protocol looks like for 0 to 3. And that would be the data set that this subgroup would help us analyze and take a close look at. Next slide, please. One of the things that we focused on as a think tank recently is actually a very old crisis, which has just been exacerbated by COVID. And that's the topic of the crisis in childcare. The availability of childcare, the related costs, the staffing challenges of maintaining staff, the high turnover rates. This crisis has existed long before COVID, but has been significantly exacerbated by it. Much of this presentation speaks to strategies JWB intends to employ to address this crisis within its mission and mandate. Just some data on the parameters of the child care crisis. There's high staff turnover, in part because of the low wage base of, on the average, $24,000 annually. COVID forced the closure of many centers as parents left the workforce, kept their children at home, but most of all, lost income to pay child care fees. And child care fees represent a very high percentage, especially for low-income parents. Child care is expensive. The quality of programming varies very widely, and many centers do not follow evidence-based standards and recommended required practices. That's both for center-based programs and for family-based care. Next slide, please. The National Association of Education, NACE, did an analysis of child care challenges and actually did a survey of providers. And these are some of the statistics that came out of their Florida survey of child care providers. 31% would not survive a closure without significant public investment and support. And you might remember that there was a stream of CARES funding that was specifically focused on child care centers, and that was a help to the centers in Florida. 56% have parents who cannot pay fees or co-fees. 26% have lost income because they are paid by attendance rather than enrollment. And 39% have lost income based on families' inability to pay fees. Next slide, please. These are JWB's strategic responses, and they represent the sub-strategic objectives under our overall goal: to increase access to care, and one strategy for that are the new quality early learning centers, which I will speak to in a little bit more detail later. And this is the funding or standing up of new child care centers that are evidence-based and high quality in very high need areas. The second is to build capacity and quality of currently funded child care centers, what I'm calling Quelly Strategy 2. When I came to JWB and started working with a very wonderful staff of people on the Quelly Early Learning Centers, it occurred to me that JWB was also funding other centers which were providing early child care. And that created an opportunity to enhance the quality of those centers as well. So in addition to funding new centers that required space and startup and funding, we had a cohort of existing child care centers that could be enhanced. So that's what I'm calling Quelly's strategy 2, is to enhance those other centers which are funded by JWB, to enhance evidence-based assessment of developmental milestones for children 0 to 3, to strengthen outreach and engagement of caregivers as strategic partners in the development of their children, and to promote public outreach and engagement through a 0 to 3 early childhood public awareness campaign. And we're going to discuss all of those in detail as we move forward. Next slide, please. I thought you'd like to know, I asked the question, how many programs are serving children 0 to 3 in JWB? And I was really astonished by some of these figures. First of all, we're not able in that number, that combined fiscal year 2021 number, to actually carve out how many of those children are exactly ages 0 to 3. But what we know is these are the number of children served that include children 0 to 3. And I think going forward, one of our tasks is going to have much more of a laser-like focus on the 0 to 3 children and collect and analyze data around that age group specifically. And then you can see the amount of funding that they have. And they fall into 3 broad categories. The early learning centers, of which there are 8, and this is the group that I'm talking about where we would be doing some capacity building. Then there is the partnership with the Early Learning Coalition, where JWB provides enhancement funding, which increases the access for families to childcare. And then the early learning and support services are family support, family engagement, and those kinds of services which really address that area about working with caregivers. So we have those 3 sort of broad categories of programs. For Strategy 1.4, invest in the expansion of capacity for high-quality childcare for children 0 to 3 in areas of historically low opportunity, working in partnership with the Early Learning Coalition. Next slide, please. So this is what we're calling Quelly 1. This has been JWB's sort of historical response to this. They have had in the past and will in the future be standing up and supporting very high quality, heavily invested child care centers. And the strategy going forward in the immediate future is to increase access to quality child care by funding 1 to 3 new high quality, meaning evidence-based, following the highest standards, centers in underserved communities. Based on demographics and Child Opportunity Index data and a profile of existing child care centers, we've targeted Tarpon Springs for the site of the next center in fiscal year 22. We are looking at doing 3 sites over a 3-year period. We're targeting that 51% of the children will be from lower socioeconomic status families, and we are requiring the highest standards. In your packet, there is a list of what we call the Quelly quality requirements. So you can read about them in detail, but these are things which are referenced in the literature, the best practice literature, and standards from NACI and also standards from the Florida Department of Education as to what goes into a high-quality child care center. And they fall into the domains of leadership, organizational management, facility infrastructure, site accreditation, cultural competence, and family engagement as major domains. And you'll see the details of the requirements for all of these in the handouts that we provided to you. These to us are non-negotiable. Anybody that we would fund, we would expect them to adhere to these standards. We will be doing process evaluations to ensure that they are adhering to those standards. And where there is any slippage between the standard and the performance, we're going to be providing consultation and capacity building. Thank you, Shannon. Next slide. Our targets include child care programs, as I mentioned, in low opportunity index zones, knowledge and adherence to evidence-based practices such as teaching strategies gold and the early Head Start model. We're going to do assessment and coaching to enhance center programming, and you'll hear me reference the class assessments. That is a systematic approach of having very skilled people go in, observe the class, rate the class, provide feedback to the provider to enhance performance. Right now, class assessments are done on a sampling basis for the most part. We are going to require all of our programs to be subject to class assessments, and we're going to do a subcontract with the Early Learning Coalition to do those assessments for us. We'll be providing consultation on the areas of leadership, staff recruitment, and retention, because what we found in looking at current QELI centers that are on performance improvement or CAP plans is that a lot of the deficits are around leadership and staff recruitment and retention. So there are lessons learned from things in QELI that have not worked well that we're trying to be very sensitive to moving forward. And again, family outreach and engagement best practices. Next slide, please. Strategy 1.6, develop a program or adapt program level core, process and evaluation evidence-based measures. And the focus here is on the quality of service delivery and fidelity to evidence-based and evidence-informed early childhood education principles and practices, what an evaluation we call process evaluation. I think JWB has been particularly strong on outcome measures. I think there's more that we can do with regard to process measures. Because when we don't get the outcomes we expect, the question is why? And very often, the process evaluation will begin to identify some of those root factors that have either supported or interfered with outcome. It really is looking at the fidelity and quality with which those child care services are provided. And if they're not provided well, you cannot expect good outcomes for the children. So the process evaluation and outcome evaluation are paired. When you looked at an evaluation strategy, you need both types of data to really understand what's going on. Next slide, please. And this is the class system that we're going to be using, the classroom assessment scoring system. As I mentioned, is on-site observation and scoring by a seasoned child care professional observer or coach. We're going to have 100% coverage of that. It focuses on 3 broad domains of effective interactions that characterize quality teaching and childhood experiences: emotional support and development, organization of the classroom, and quality of instructional support. And those are the areas which will be assessed. Next slide, please. Strategy 1.1, implement a cognitive, social, and emotional evaluation tool to link children to the 0 to 3 critical services. JWB's programming should ensure linkage to quality services using outcomes to inform service delivery. And this, I would just mention that there have been several recent studies that have shown if you want to look at sort of the return of it on investment of early childhood intervention, the strongest correlations are actually between how the children do on social emotional outcomes over the long term, even more than educational or cognitive outcomes. And if some of you are interested in seeing that, we can make some of those studies available. What this speaks to is that we really need to assess children for developmental milestones in the social emotional area. Next slide, please. We're going to be screening, and I wanted to emphasize the difference between screening, for example, social emotional domains, and developmental learning over time, which is more cognitively focused. So the purpose of the screening is to assess early for developmental delays based on key developmental milestones and to make appropriate referrals as early as possible when children are not meeting their milestones. The instruments we're going to use for that are the Ages and Stages questionnaire, the ASQ, and the ASQ-SE, social emotional. And this has evidence-based developmental milestones for children at different ages. And the key question is, are those children developmentally on track? And when they are not, we need to make very quick referrals for them to help them get back on track. JWB is currently using the ASQ. We will be adding the ASQE. And right now it's conducting a survey of the early childhood programs so we can look at which programs are actually consistently using the ASQ at the current time and what are the things that they are observing as a result of the application of those instruments. We'll also be looking at developmental learning, more cognitive learning over time, and we will be using evidence-based measures of that. Things, for example, like Teaching Strategies Goal, which is an evidence-based intervention for children 0 to 5. Next slide, please. These are the domains of the Ages and Stages questionnaire. It is completed by parents, or should be. I've learned that in some cases, some agencies are having the instrument completed by the staff rather than the parents, which is really not following the protocol for which it was developed. It was developed for parents because there are things related to what goes on in the home that the staff person is really not privy to. So we're going to require that it follow the methodology and have it completed by parents. It assesses 5 domains: communication, gross motor skills, fine motor skills, problem solving, personal and social relationships. Next slide, please. The Ages and Stages questionnaire, social emotional, again, is completed by parents, and it looks at 7 behavioral areas: self-regulation, compliance, communication, adaptive functioning, autonomy, affect, and interaction with people. And I think if you would talk to early childhood educators, particularly around the children they find most challenging, there are deficits in these domains. The ability to be part of a group, to sit and pay attention, to self-regulate. These are deficits that they are seeing, not to blame the children, but things that they are seeing that need to be addressed. When you communicate ASQ results to parents, it's really important that you provide those screening results as quickly as possible. This is all about early intervention, as early as we can possibly do it. Review the scores, emphasizing the child's strengths, and that our intention is to make areas where they're challenged even stronger. Be careful with language used when describing score results because the education of parents will vary widely, as well as the fact that some of it may need to be translated for parents who do not speak English. Provide parents with follow-up, including developmental information, as well as a referral discussion if it's necessary. So when we do the ASQ-SE, when we find children that are developmentally delayed, timely referrals are part of our model. It's not just to sit down and discuss with the parent that there are problems, but what can we help them do to address those problems? Next slide, please. Our academic benchmarks will be Teaching Strategies Goal, which is for children ages, there's a version for 0 to 3 and then 0 to 5. 100% of the 8 JWB Early Learning Centers are currently using Teaching Strategies Goal. It's been one of JWB's contract measures for these centers for 5 years. What's great is looking at children 0 to 5, 80 to 90% of the children were able to meet expectations for their age group, which is a great outcome. So we're going to continue use of Teaching Strategies Goal for all JWB funded centers.
Barbara, I'm going to ask you to hold for a
Yeah.
moment. Is it a question that you want to ask now, Karen?
I do.
Okay.
Yes.
Going back to the ages and stages questionnaire,
Mm-hmm.
I guess because I'm curious because you said it should be done by parents, and without looking at the questionnaire, how do parents know if their child has the gross motor skills or the fine motor skills if they don't know what the benchmarks are?
There are very specific questions in easy language, which says, can your child do this?
Okay.
Can you observe your child doing that? So the concepts are operationalized in terms of specific observable behaviors that parents can make. So they give like a little scenario and, how does your child respond to that? Or is your child able to do this? The instrument was developed for parents and normed on parents when it was developed. So the language was probably, I would say, a third grade reading level is sort of a standard in the field for what the questions are like, but it's described in terms of observable behaviors. So the parents are responding to observable cues.
Mr. McCurrick, you have a follow-up question?
Just to follow up, with that, because I understand the need to have the parents respond. At 0 to 3, having a single parent, one parent respond, I'm not sure whether or not you'll get all the information that you're really looking for. And my concern is that at 0 to 3, as a parent, I may not want to see what you're asking. And is there an option to have multiple caregivers within the family?
There would be no problem if there were 2 parents asking them both to fill it out. But I will say this, remember that providers are also assessing some of these same domains. So that provides some cross-validation. It's interesting, I did, and I'll tell you why it's important. I did some research with somewhat older children in terms of acting out behavior. And what the investigator found is that the degree of acting out changed by the setting. So, for example, if they were with peers, it looked one way, like on the playground. If they were in school, it looked another way. And if they were with the family, it looked slightly different. And so that investigator developed 3 versions of that instrument that could be completed by family, by teachers, and actually by peers or with peer networks. So I think with all of these instruments, nobody can have a full 360-degree view. You understand the context in which the assessment is made, and I think the fact that we're going to have instruments where providers, child care providers can also assess the children. It puts the rating by parents in context. My problem was not getting any parental assessment at all, which had been going on in some of the programs. Okay. Strategy 2, engage parents, grandparents, and other significant adults in the child's life to promote healthy caregiver relationships and to provide advocates for young children. I mean, parents are children's first teachers, and engaging them, and particularly, for example, with many African American children, if their parents aren't available, they're being raised by grandparents and sometimes great-grandparents. So when we say parents, we're talking about the primary caregivers of those children, regardless of what their relationship is. We have JWB funds a wealth of programs that provide family support and engagement, and of course, those will continue. Examples are the Nurse Family Partnership Program, the Early Learning Support Program, Early Childhood Services, Healthy Families, Pinellas, Motivating New Parents. And what's interesting about Motivating New Parents, it used to be called Motivating New Mothers. And they changed it to parents to include the focus on fathers as well. Kinship Services Network of Pinellas County and home instruction for parents of preschool youngsters known as the HIPPY program. Next slide. Strategy 1.5, strengthen and continue home visiting programming targeting especially high-risk populations. Next slide, please. Examples of those programs are the Healthy Family Pinellas that we do in partnership with the Florida Department of Health, the Pinellas Nurse Family Partnership Program, also with DOH, Family Focus at Park, and the R Club Special Services. So many of you will be interested and very often ask the question, how are we going to know if any of these new investments make a difference? This is what I see as the 0 to 3 result area evaluation agenda. First, we need to assess program quality and improvement over time. That's the process evaluation. And we will be using the class assessment results to make that determination. That is the observation and rating of the classroom. We're going to document systematic screening, including referrals, follow-through, and results for ASQSE. Not just were the children assessed, but were they referred? Were the referrals actually followed up so that services were provided? And what do we see in the changes in the ASQ over time to know that the children are improving in those domains? We're going to evaluate progress on development and educational milestones over time using the teaching strategies goal. We will be evaluating progress on measures of family outreach and engagement. All of those programs have outcome criteria, and I think what we need to do to work is perhaps standardize them a little better across those family programs. And then the media campaign, we will be looking at reach out, access, and feedback. And April Putzulu is going to say a little bit more about that later. Okay, next slide. So here are our general budget request categories. Let me wrap some caveats around this. We are just now beginning to conceptualize along the lines that I've just presented to you what we would like to see happen in the 0 to 3 domain. There's still some unknowns about how that's specifically going to look. For example, we're entertaining a couple of additional potential collaboratives with ELC, which are not reflected here, but might be in that allocation going forward. So right now, for fiscal year 21, our most well-developed initiative, which you'll hear about shortly, is the Outreach and Early Childhood Public Awareness and Media Campaign. So we have a specific budget for that, which April will present to you. With regard to Quelly and standing up the new child care center, we've requested kind of a hold of $250,000 for future programming. And with respect to Quelly 2, which is increasing the capacity and quality for the centers that JWB already funds, we're requesting a $500,000 hold in future programming. Those amounts might change as we develop more specificity, but we at least wanted some funds set aside for us to be able to work with. I am going to let April talk to you about the media campaign, and then we will answer questions collectively at the end. Let me just say before I leave, I want to thank my staff, and 3 people in particular, Karen Bojes, Cheryl Miller, and Dr. Chin Fan, who have worked incredibly hard with me in a very short period of time to conceptualize this, to build on JWB's track record and really envision what we want this to look like in the future. So I do want to acknowledge their contributions. And now, April, you ready? Okay.
All right. I'm just going to remove this and move it up. Thank you. Thank you, Barbara, and good morning. Barbara certainly has us excited about all of the possibilities. And I'm here to share a plan to launch our public awareness and education campaign to target parents and caregivers of children 0 to 3 so they understand and apply the principles of early childhood education and development. You know, in essence, what we really want to do is we want to level the playing field. We want all children to have the social, emotional, and cognitive skills so they enter VPK kindergarten ready to learn, and then they have success in school and beyond. So we've taken some initial steps I'm going to share with you. I've held dozens of discovery sessions, and I will tell you that everybody that I've had the pleasure of meeting with, local experts and stakeholders, have been super excited and passionate, and some even asked for a second session to share more. I'm going to share some of their themes and ideas that have bubbled up shortly. We're in the process of doing environmental scans to look at what's happening nationally, regionally, and locally in this space, similar campaigns, and some of the lessons learned. We're positioning the campaign under the think tank, the implementation and strategy and implementation subgroup that Barbara mentioned. And we are beginning to identify individuals in our community who will serve in an advisory role. Those are those that have interest and expertise that will help us inform the campaign, review proposals, and serve as our feedback loop. So what we want to start with is our goal is to build what we call the 4 C's. We want to build confidence so that parents feel confident, parents and caregivers, in training their babies' brains, in being those first teachers, and starting at prenatal and starting at birth. We want to build competencies so they also have the knowledge and the tools they need to be successful. And we know we need to build capacity by using ambassadors who are trained and champions in the community that will help us do the outreach, help us grow, and expand our reach. And ultimately, I use Barbara's words, we want to blanket the community so everyone understands the importance of baby's first 1,000 days. So these are some of the interesting themes and ideas that have bubbled up, and a lot of these are supported through some of the national campaigns as well. These came out of our discovery sessions. Parents and caregivers ultimately want what's best for their children, and they are their child's best and first teachers. Again, we need to instill confidence and acknowledge and celebrate the important role they play. No diploma or degree is needed to build a baby's brain. We heard that from many, that parents don't feel confident, so we need to help them get that confidence and give them those tools. We also heard from many that we spoke with that parents believe it's the school's job to educate their children and teach their children. Well, we know by 4 or 5 that's too late. So we need to really emphasize the importance and give them those tools and confidence to truly be their child's first teachers. This one we heard from Dr. Nasaria during our Children's Summit. No app can replace the lap. And we love that. We've embraced that. And we heard that from many that we spoke with. Parents and caregivers should turn off the TVs, put down the devices, and bond, talk, sing, play with their babies. We need to work on replacing baby talk, which is cooing or imitating a baby's sounds, with parentese. This is an infant-directed speech that uses complete sentences, but still is characterized by higher pitch and slower tempo. Reggie Randolph, if you remember, who works with our dads, was one of our kids' first winners. He said what he does with his dads is uses a sports analogy and tells them to do a play-by-play, like in sports, so that they narrate what's happening around their baby, but they're actually talking. So I think today the dads are telling their babies about the gas shortage, probably. And another theme that came up that was super important is we need to identify everyday opportunities so that parents, who say, I'm busy, we know they're busy, some are working 2 jobs, single parents, that there are everyday opportunities to talk, sing, read, and play. And I was going to quiz you today, but I don't know. Do you know how many in baby's first years, how many diaper changes? So there are roughly 2,500 diaper changes, 4,000 feedings, and we hope about 365 bedtimes and bath times in baby's first year. All of those represent teachable moments. That was another theme we heard. We also heard from everybody that we must meet parents where they are. we need to go to parents. We need to, especially those who decline formal services. We must have a plan that is multidimensional, with parents reaching out to other parents, ambassadors who are from and live in the neighborhoods where parents are, and we must reach parents in places where they're naturally going. Youth sporting events, churches, community centers. Outreach is going to be key with this campaign. And then finally, but importantly, we must target campaign messaging, materials, and strategies that are culturally responsive. We must meet the diverse needs of our community, and young parents, fathers, grandparents, and families of color, for example. Those were all themes, and one of the themes that bears repeating is no app or device can replace the lap. So our idea is that we give every child a laptop. Not a computer, but a human laptop. And this was a great phrase, a quote from former Secretary of State Colin Powell, where he said, all children need a laptop, not a computer, but a human laptop, moms, dads, grannies, grandpas, aunts, and uncles. So that is one of the keys to our campaign. And then our next steps. So right now we're wrapping up our discovery sessions and our research, and that will lead us to develop a scope of work for our procurement, to procure a creative firm. We'll also be identifying success indicators Barbara mentioned. And then in September, we'll be seeking approval from the board to release the RFP. The first quarter of next year, we're going to be reviewing proposals and making a recommendation of a creative firm to the board. And then the first of next year, collaborating with that firm, holding focus groups with parents and caregivers, developing and launching the campaign next May or June. And that is our proposed timeline. We have a proposed budget for FY22, which you see up on the screen, of $125,000, not to exceed. Up to $75,000 of that would be to procure a creative firm. That would include all of the parent and caregiver focus groups, developing messaging, design, toolkits, collaterals, and a website for the campaign. We also included funding for year one for the printing of toolkits, collaterals, and advertising in year one. So thank you very much. At this time, Barbara and I will entertain questions.
Mr. Bartlett.
I have some questions just about the mechanics of this. I'm kind of getting a little lost in the materials. We've heard this as 0 to 3 age group, correct? Yeah. Some of the materials talk about 1 to 5. Some of them talk to 0 to 3rd grade. Is the main focus on just the 0 to 3 child?
Yes, for this result area, the focus is on 0 to 3 children.
Okay.
And sometimes when you see an instrument or a set of measures that talks about 0 to 5, within that band, they have age-specific measures. So there's something for example, the state of Florida has a teaching strategies goal, and it is for infants, toddlers, and tweens. And the content and the result outcome areas are different for those 3 age groups. So it's packaged for 0 to 5, but it's age stratified within it. So we know what is appropriate for an infant, we know what's appropriate for a toddler, a 2-year-old, a 3-year-old, although the title may say 0 to 5. There's a completely different set of expectations, obviously, for an infant as compared to a child who's 4 or 5.
And how do these people with these children, 0 to 3, come into this realm of assistance? How do they get there? Are they targeted by, you talked about going out in neighborhoods and all that kind of stuff. Do you solicit the caregivers / parents?
Yeah.
Do you provide childcare and that's how they come to you? How does this get to them?
Some of it will be provided through childcare, but not all children go to childcare. So I think April's point about doing the outreach and media campaign is to reach the parents wherever they are. There are some children who are in informal care, like with an aunt or a neighbor, in family-based care that's not child-centered care. There's children who are in centers, and we're looking at trying to reach them in all of those areas.
It just
if that
seems to
answers
me
your
that
question.
It's a fair amount of money that's being expended for a small amount of children, it's particularly in the first category, 433 kids and a $3 million
Well, I
figure.
think in the outreach and evaluation campaign, that's not limited to the children who are in the centers. That's not going to be a small number of children. That's going to be, if we're successful, it'll be a large-scale campaign that will reach many, many families and children, not just the ones who are in JWB-funded centers.
And again, I'm just trying to clarify in my mind how this works. So you have these funded centers that we're going to open up additional ones up in Tarpon Springs now. And is that for the care of the children so that we have people who provide that care and observe those children? Or do we have interaction with the parents that come in where they're actually taught these things that we've talked about and how to better raise their children, how to better interact with their children, how to provide that lap and all that kind of stuff? Because if not, they're just going to get the affection from the care workers and they're not going to get any of this thing brought home.
It's both. It's both. Even for children who are in centers, they go home and they need the support and guidance and development for their parents. So these are coordinated strategies. It's not a professional service versus family. It's both.
Okay, but you understand where I'm coming from, is that if you don't reach the people who are home doing this caregiving, a lot of people just want to dump their kid, boom, go off and do whatever they're going to do, work or whatever story they may tell you they're doing. So that child gets that affection and need and you know, there at the place, but they don't, when they get home, it's right back to old school stuff. So
Right. That's what April's campaign is about, that there's so much more that you can do for your child. Couple of messages. There's a lot you can do to develop your child. Secondarily, you should. We will give you some strategies that you can employ. But the other thing is to make this a priority. To say to parents, every opportunity you get, participate in the development of your child. Make it a priority. So we hope that they won't just bring the kids home and plop them in front of the TV, that there are things that they should be doing.
I get that. I'm not trying to be cut short, Barbara, I'm sorry, but I just don't, I think there's a significant issue because these types of people you're targeting are the types of people that aren't there for their children generally. So grandmas maybe raising a child, aunts raising a child. So how do we make sure that we are conveying to the right people who are responsible for these children in a classroom sort of setting, if you will, for the parent or caregiver, this is what needs to happen to continue this positive growth in the developmental skills of this child.
Right. But I think that if you,
That's not considered to be the weak part of the whole program, and I'm not suggesting that I have an answer. I'm just saying, and sitting in here knowing nothing about the program other than the materials I've seen, it just seems to me that's one of the more difficult obstacles is to
it will be a challenge, but notice that the campaign is for caregivers, which may not necessarily be the biological parents. It's the aunties,
I get
the
that.
grandmother, great-grandmother.
So,
I get that.
yes,
It's just
if I
making
may,
that
sure.
There's some mentoring on our part within the classroom setting or with the school setting or whatever, that, you know, these values and how important it is to go back to have them send it forward.
Absolutely. One of the things that we found successful with our Safe Sleep campaign, our Sleep Baby Safely, is partnerships with OBGYNs, with our birthing hospitals, and our pediatricians. And we have approximately 8,500 live births a year. So outreach to, like a universal outreach to every parent at birth, and then layering that on with personal outreach through neighborhoods and ambassadors at the community level and parents teaching parents. So through our neighborhood family centers, you know, through the partnerships that we already have out in the community. So that is the plan, to look at all of the touch points where we can reach parents. Now, the challenge, as you've mentioned, is how do we change their behavior and motivate them to want to change and want to teach and do what's right, you know, for their children. But by and large, our assumption is parents want what's best, and they are the best first teachers. And so we're going to build on that to build their confidence and their competence in that. Did that help to answer the numbers?
Will we be 100% successful? No. We'll do our best.
Now, I get where you're coming from. I just think from a reality standpoint, that is going to be a very difficult hurdle to bring it back home, because you assume these people are the kind of people that want to spend time with and be participating in the life of their child, or their caregivers, children, or however you want to characterize it. But that is the problem, is that the parent generally is not there for the child when they need to be there. And then it goes off to somebody else, and then they're obligated sometimes beyond their capacity. So unless we reach out to that dysfunctional family issue and try to affect that, it's not going to help you over here.
Well, remember that we talked about the nurse-family partnership and the family home visiting programs. Those are targeted to high-risk families, which have some of the behaviors and the complications.
But how do you know they're high risk? That's I guess, where I'm having my connect.
They do an assessment of them. I mean, assessments are part of all of these programs, or they may get referrals from the school system or child care providers or other places. I mean, identifying fragile families and working with them is a challenge in every program that JWB has, and it's no different for this. But we do try to identify them, get them interested, work with them, help build their skills. As I said before, will we reach 100%? No. Will we be successful with 100%? No. But if we can improve the situation over what it is now. And the other thing in my mind is particularly to get to young, new parents so that they understand this from the beginning, instead of having to learn it later after they're challenged with other kinds of issues. So I think April's point about having messaging that we can provide in maternal child programs when these babies first arrive, and emphasizing the importance of brain development early. I am not going to minimize the challenge. You are correct. It is going to be a challenge, but we're going to do our best.
Well, I'm sure you are, and I'm not being critical of you. I'm just making some independent observations of the proposed program and the cost of the effectiveness, the dollar we're spending for what we're getting back in return. Because so many of these people just do not want to follow what we would ask them to do and accurately provide information for you to do your assessments, because they just don't want to participate. So that's all.
We can't make them all.
I know, I'm done. I'm just get off my soapbox.
Barbara, do you want to talk a little bit about essentially return on investment for early childhood?
Yeah. So the concept of return on investment, and it's measured in very, very different ways, is to try to come up with an actual dollar figure of, for every dollar that you invest in early childhood services, what is the payoff further down the line? And typically people will look at things like lifetime earnings of workers who were exposed to early childhood services or pre-care versus those that not. So I've seen some estimates which say for every dollar you invest in child care, you realize $13 in additional wages as these people grow up and become productive. Sometimes the outcome measures are what you save from spending on services like juvenile justice, for example. Or so if you work early on with children on behavior regulation and they don't get into the juvenile justice system, for every dollar that you put into child care, you save so much during their teen years. There are many different methodologies for doing that. But a lot of people who are more driven by cost concerns, and legitimately so, there's an effort to try to say, for every dollar you invest in early childhood, what is the financial payoff further down the line? And people measure that in different ways.
I have a couple of comments and observations, and I do see Mr. McCurrick behind us. So just to clarify a little bit, typically, when you say early childhood, we think 0 to 6. But in this case, we're looking at early childhood strategic plan for JWB is 0 to 3, and then we roll into a school readiness.
Right, exactly.
So a school readiness mode is typically 3 to 5.
4 to 5.
Right, or 3 to
Right.
6. So I want to come back to a point very early in the presentation when you gave us the total children currently served with the dollar amount. And there were 4,619 children served. But your point was that at this moment, JWB is not able to segregate the 0 to 3 population.
Yeah, to carve them
and the point that I would like to make is I would like to ask JWB leadership to do that segregation of numbers fairly quickly so that, to Mr. Bartlett's point, we will have adequate current information on the children served 0 to 3. Not sure we can get to the dollar amount, but in order to come back to the board and be able to have that number, I would hate us to be here 6 months down the road and say, oh, we still weren't able to segregate the 0 to 3. That if we're investing this pot of money, this manpower, woman power, into these initiatives we all think are the right thing to do, we want to start with the most accurate, up-to-date data that we can get.
Right.
And so, because it's now a strategic focus area for JWB. Mr. McCurrick?
Yeah. Is there a comment that wanted to be made before I?
Karen?
I'm sorry, I just wanted to clarify. So the numbers that, and I don't know if you can bring that chart back up, Shannon. So the numbers for fiscal year 20 and 21 that were presented in that chart, 433 that went to centers. I believe it was a little over 2,000 for ELC and a little over 1,000 for our family support programs. Those are children 0 to 3. We are able to segregate them out. So those are children who were 0 to 3 during fiscal year 20 last year or this year. The dollar amounts that you see can't be segregated out. So when you look at the $12 million for early learning support services, you saw that in there was a kinship program, in there is a respite program. And so those programs serve a wider range of children. And so we are not able to segregate out how much of those dollars are spent exactly for the 0 to 3 age range.
So just to clarify.
So that was my error. Those are 0 to 3.
The
4,619 are currently
0
to 3. They were served
during
last year and this year, the total, and they are an unduplicated number. I know someone had mentioned earlier about duplicated number. We are able to unduplicate. So that's 4,619 individual children 0 to 3 that we were able to serve between last year and this year.
Thank you very much for that.
Separate out the money for
Yes.
That's fine, but I think that's a wonderful piece of information for us to be starting with.
So, but let's stay there and then we can move on to the other things I wanted to say. But 4,600, 0 to 3 is a number that we can address that we've had some connection to or impact to it. What's the number of all the others that are all other children 0 to 3 that are out there that we haven't come close to? But that's what we need to know. We need to know that because the impact of what we're really talking about is we're not talking about this 4,600 children. We're talking about a much larger number that we need to address. And I think that also, I think you were right in saying we don't know what the real final measurement, how much we're going to change or that matter save, but I've got to believe, personally, I've got to believe that we're spending a great deal of dollars on readiness and reading and the like to try to catch children up. And I believe that this initiative will begin to decrease that number and we'll be able to work through that. The piece that I'm really want and ask you to hone in on is in the outreach and marketing side, because that's to hit all those others that we're not touching today and not going to get to. And that has to be, we've done great jobs with the swimming programs and, still children dying in the cribs and those things. We've done a lot for that. And we're going to do more, I know, with the, getting fathers more involved. we've got to have a broader media campaign that really addresses the need for parents to understand their role and whether it's them or others. And I think Mr. Bartlett's right. There are plenty out there that'll probably just want to, I'm going to drop a good portion of those children off. Others aren't dropping them off anywhere. They're in grandma's house or they're in a neighbor's house or something like that. And those are the people that we really need to impact with our message and to really get them to understand what they're actually doing. It's not just babysitting or just watching that child, right?
I think April's campaign is our best shot at that she's designed, the outreach and media campaign, to hit the broadest audience possible. And that's where we could have impact at that level.
And see, but that's where I think we as a board really need to understand the breadth and depth of that program and how we're going to reach out to the community to better understand that.
Aside from what April presented, what information could we provide to you that would convince you that that's our intent?
You don't need to convince me at all. I mean, what I'm looking for is to see what the progression is. I'm not asking you for it today. I don't know that you have it today. And I'm really looking for the impact and input coming back. You've got a wealth of knowledge sitting in your think tank. I want to see what's coming back from the caretakers themselves. What are they seeing? What's happening? How are we going to adjust and create this program to be so successful that we know we're going to limit and decrease the amount we're spending in other areas, and we're going to help the juvenile programs to reduce the number of impacts that they're having to deal with. And more importantly, we're going to help make children more effective for themselves and their lives and moving forward. It's all soapbox type stuff right now until we really see how we're going to do it and what it's, and then measure the success of that.
Well, as April mentioned, we'll be working on an evaluation plan for outreach and media campaign. They're challenging. I mean, those kind of evaluations are very challenging because you're sending a lot of information out to a very broad audience. First, you want to know, has anybody listened? So we look at ways of measuring reach. How many people, for example, if you have something on a website, how many hits did you have? If you have something where they can follow up, how many people have followed up? But media campaigns and people in the media industry will tell you it's not easy to measure the impact and the scope, but we will do the best we can to come up with the methodology.
I mean, part of that is just visibility and having it out there long enough and strong enough to really just capture. You can't get away from it, you're seeing it.
No, you can't. But what we would hope is over time, we would see, and where it'll show up is both on the 0 to 3 measures. Are more and more children scoring developmentally on point as time goes on, because it's going to have a saturation and seeping in kind of effect, and we will be looking at those results over long term. Are more children 0 to 3 developmentally on point? And if they are, their likelihood of being ready for kindergarten at 4 and 5 should go up. This is a continuum. Somehow, there's one thing influences the other. And if those children are very slow and delayed in the 0 to 3 period, it is very hard for them to catch up 4 to 5, and they stay significantly delayed going forward. So we're looking at this as a continuum and measuring progress across.
And it's important for us as the board to understand that there's no short-term solution here. This is a long-term program.
It's a long-term set of interventions. It's a long-term set of effects. And what I would say is that the deficits in this area have been known for a very long time. Nothing that we're talking about is new information. So what we're hoping is to be able to contribute to the solution of that, in addition to what other domains. There's going to be a lot of emphasis, for example, with the movement of the early childhood, is becoming more concretized in the Department of Education. Deb Pruitt is going to talk to you about policy. There's a huge emphasis on child care and early child care in federal legislation and funding, so all of a sudden, it is getting some attention. But we will be riding that wave as well.
Again,
right.
all good things happening from a political and perspective. We've got to get to the grassroots, which is the parent, the grandparent, the family caretakers, to make sure they're ready to do it.
I think it's very important, and I'm saying this as an African-American woman. People get upset when parents don't do their job, and so do I. But we have a very long history of caring for children in extended networks when their parents are disabled for any reason. So the fact that a child is being cared for by a parent or a grandmother or a great-grandmother or an auntie is not necessarily a deficit in our eyes. We're keeping those children out of the child care system. We're keeping them at home. We're keeping them in a family network. And whoever the caregiver is in the family, we will work with them because they're the ones who are going to see that child come forward.
Very good point. Ms. Mala?
Just briefly, and I think that we really touched on the point that I was trying to make, is when you're talking about marketing and identifying the impact of that marketing, and I recognize that that's a difficult measure to make, but I do think you could look at different areas where the community has done high campaigns and what the result of it was. And my concern is how we're spending the money. So you can market something, but if somebody's not buying the product, it doesn't matter how good your marketing is, right? And so is it that they're not buying the product, or that they can't, or they're not sure how to, right? So when you get a grandparent or an extended family, and would those dollars be better instead of sending out a blanket marketing to people that, you know, as Mr. Bartlett's pointed out, maybe just not be interested in the services even if they're available, and instead using that money on that extended care family, giving them a more depth of services or a more targeted impact on identifying those high-risk individuals. So
well, we have services for them, and I displayed some of them. This is not either or. We have targeted services. The family visiting, family intervention services are for those high-risk families that you're talking about. April's approach to the campaign is everybody. So you want to address that?
Yeah, so while there will be a broad awareness part of the campaign, most of the campaign will be targeted. And so when we think of a campaign and a public awareness and behavioral change campaign, not in just the terms of media or, you know, materials, it really truly are toolkits, practical things that parents can use, going in and using ambassadors or other parents who are trained, or even possibly giving stipends, but some type of way to train them so that they go in and deliver the message and it's received by the other parent or grandparent. And we have our partners. If we were doing this campaign alone or just simply doing a broad brush, I agree with everything that's been said. But if we are using our power of our think tank and our partners out there who are excited about this and really listening through those focus groups with parents and caregivers and really meeting them where they are and really truly everything's not going to look the same. So toolkits and materials are going to look different for fathers than are going to look for young parents, grandparents, the messaging, et cetera. The way we reach them is going to be different. You know, we're not going to reach young parents maybe on Facebook. They're going to be reached other ways. So everything will be customized or targeted for those specific subgroups or populations. And truly, when we think campaign,
how do we know that they're not being reached? What indication do you have that the information isn't out there versus not being utilized? It is out there, it just isn't being utilized. That's kind of where I don't.
Right. I think the things that we can hope to achieve are more children signing up and enrolling in VPK, so parents understand the importance of that, continuing that education. We will see children entering VPK, kindergarten, et cetera, who can self-regulate, who will know their numbers and their letters and will have some basic skills when they start. And ultimately, we say, you know, in leveling the playing field. But I think those are all, you're right, the work is yet to be done. This was an initial sharing of where we're at to date, but now we need to build the procurement. We need to search for that firm through a competitive procurement process and then bring that back to the board. But this is, as Mr. Mercurek said, this is a marathon, not a sprint, and you know, it will take all of our partners to be on board. And I know that right now, and it will be a multi-dimensional campaign. And when we think in terms of campaign like our grade level reading campaign, where we have strong training involved in that and ambassadors, it will be much more than a media campaign, so to speak. So, I mean, I hope that answered. I mean, we look forward to coming back with more development in this area and bringing that hopefully in September.
And I'm going to begin to look at the clock because we have a legislative update, which I know we're anxious to hear as well. Any burning questions or comments, other than an extreme thank you? I think the quality of the presentation today, the work, the information that you brought to us was just outstanding. And, you know, it's a new space for us as Juvenile Welfare Board. And I think back to the presentation, and I can't think of his name, the USF professor from the, I'm sorry? Dr. McHale, when he came and he spoke to us about trauma in infancy and untreated infants who had experienced trauma, it absolutely resonated that this is a new space for us and we're just making our first steps out there. And I appreciate the work, the think tank, the population of people that's in this with us. But I know it's a work in progress, and I appreciate the advancement of this strategic initiative that was just approved in September. And so I sit here today in May and say, we've come a long way, and we'll begin our marathon now.
Thank you. I appreciate that.
Thank
This is
you.
not going to be easy, but we're going to work at it.
You bet. And Deb, you've been patient, but boy, we sure do want to hear from you.
Good morning. So Shannon and I are going to try to do the PowerPoint hokey pokey here. So the first slide is just to reiterate the Juvenile Welfare Board's 2021 Legislative Public Policy Consensus Platform that you all approved in March, and give you a little update on what we were able to weigh in on during this legislative session. We basically straddled two impact areas that we believe are not only important, but they correlate with one another. That's the early childhood and school readiness, and then the child nutrition and food insecurity. So during the session, we had the opportunity to either participate in sign-on letters or communicate directly with our legislative delegation as it relates to emergency TANF funds, which, if you remember in March when I spoke with you, Florida has some of the lowest monthly rates in which families who are eligible for TANF receive funding. The average family of three is receiving $303 a month. The federal government allocated $35.5 million to the state of Florida through the American Rescue Plan. However, unlike other funds, the state had to request those funds. They didn't just come automatically. So we were asked, along with many others throughout the region, to encourage the state to not only accept those funds, but we went a little further in making a recommendation that the funds be provided in two payments in May and June of $415 to help jumpstart families as they move into the summer. Expenses are more if you think about families, kids being home all day, the door opening and closing, the air conditioner continuing to run. We know that the expenses increase for some of our lowest income families. The additional sign-on letter that we participated in that our CEO signed was with the Florida Policy Institute to support the extension of postpartum Medicaid health coverage for new moms from 2 months to a total of 12 months or 365 days. And that's an extension. The Speaker, Speaker Sprouls was very clear that it was not an expansion, it's a one-year extension, and the state will monitor that and see what the impact of that is, and we have every expectation that we're going to see some benefit in that impact. There was also advocacy during the budget conference process. The Senate was doing a significant cut to Healthy Start, along with some other significant cuts in other parts of the budget, and we were able to weigh in with members of our legislative delegation and rectify that and bring that back to its fully funded status. So these were two bills that I told you about again in March. Just wanted to give you an update. Both of these bills passed. The first bill, House Bill 419, is the Early Learning and Early Grade Success. That particular bill is going to make some significant changes in what we know as school readiness and voluntary pre-kindergarten. The most significant change is to establish a division of early learning within the Department of Education. That was kind of a touch-and-go issue. The Senate had pulled it out of their bill, and so it took some wrangling and some back and forth to put that back in the bill and make that happen in the final passage. It's also going to create a pre-K through third grade literacy and math progress monitoring system, and that's going to be that bridge that gets children from the young program through to the elementary age program, which is our school success program. And then there's going to be some significant VPK accountability changes for the providers and to require them to get to standards so that we have a greater percentage increase of pre-K students who are ready for kindergarten. The state is vacillating in that 41 to 43% ready for kindergarten. And so that is really the major focus of this piece of legislation. It was funded with $7.5 million of federal funding through the education supplemental funds in the American Rescue Plan. And so it will help boost the state's ability to hit the ground running and actually implement this probably a lot faster than they normally would have. And just for clarification, the voluntary pre-K per student rate is at $2,486 per child. And that's for the year-long program, a 3-hour per day program. The summer program, which is done in 6 weeks, and I believe it's around a 6-hour day, is at $2,122. And that doesn't mean anything unless you balance that with what the rates are throughout the country, and those rates are ranging anywhere from $4,460 per child to $13,158 per child. So there has long been a need, if you want to get to kindergarten readiness, that there's going to have to be some effort and willingness put into expanding the cost per child. Some of that can possibly happen as we move forward in the Biden administration. They have talked about fully funding voluntary pre-K and making it a combined 3- and 4-year-old program. So there could be some federal opportunity for the state of Florida and other states moving forward. But Florida is by far one of the lowest funded voluntary pre-K programs in the country. The budget also includes a $1,000 bonus for childcare and early learning workers. It's intended to be paid out in 2 allotments of $500 each, and that's going to happen over the summer. I believe the first payment comes in late May or June, and the second payment would come in July. And that is also made available through the American Rescue Plan. Dr. Morrison Rodriguez spoke about the CARES Act dollars that were made available to child care providers. And I think it's important to understand just the amount of money that is available to the state, that the state has used and that they will have access to in the future. CARES Act brought in $3.5 billion to child care workers, or child care programs and providers. The second stimulus package funded $10 billion. And the American Rescue Plan has funded $39 billion, of which Florida is eligible to receive $2.5 billion. Now, all of this was happening, at least the American Rescue Plan portion was happening during a time when the budget was being put together. The initial plan was not to even recognize the American Rescue Plan dollars because the state hadn't officially received them yet. Midway through the session, the state received a bulk of those dollars. So there is substantial proviso language within various sections of the budget and in the back of the bill that give state agencies the opportunity to receive those dollars through the Legislative Budget Commission process. And so the allocation of those greater dollars isn't known now, but those opportunities will present themselves throughout this next year. Can you back up, Shannon? I'm sorry. I got ahead of myself. The other bill is House Bill 3. This is the home delivery books for elementary students. This is the New Worlds Reading Initiative that is Speaker Sprawl's initiative. It too was funded with some dollars from the American Rescue Plan. It will also be funded through tax credits that corporations can donate books to the program, and in exchange for that, they will receive tax credits in a variety of industry areas. A bill that straddles both of these bills and kind of has some cross population of issues involved in it is the Student Literacy Bill, House Bill 7011. It was funded with $6.5 million of federal funding, and it is going to substantially change how literacy is approached on a state level. If you've had an opportunity to hear the speaker in a number of his press conferences, he calls it radical disruption. And so this is the kind of the output of that. It's going to offer reading achievement initiatives for scholastic excellence programs within DOE and revise the requirements relating to reading instruction and allocation. And that's all with an effort to get kids reading on grade level, have them reading by third grade so that they learn to read and then they read to learn. Two other bills that passed this session that kind of speak to 50,000 foot level of services is House Bill 1349. It's a public assistance bill. It's going to help determine the impact that families have when they're on what they call the fiscal cliff. And the example I can give to you of that is when a parent receives a 50-cent raise, they then potentially become ineligible for things like childcare, subsidized childcare. And so in trying to enhance their career, if they accept that 50-cent raise, they lose their childcare, and then they're unable to make ends meet. So this bill is going to require a study that will look at the eligibility criteria and find ways to adjust it to make it more flexible so that families do have that opportunity to move ahead in their careers, still have childcare and some of the other assistances that are making things happen for them. Senate Bill 252 is the Child Safety Alarm Act. After January of 2022, vehicles used by child care facilities will have to be equipped with an alarm system that will alert them when, if a child has been left behind in the van. The Department of Children and Families had some estimated cost ranges. It didn't say in detail the difference in those ranges. I'm guessing it depends on the van and the configuration, maybe the size. On the House floor, this bill was co-sponsored in the House by Representative Diamond. He did ask that the state look to see if school readiness safety dollars could be used to assist child care providers in paying for these alarm systems. It's also possible that some of the federal assistance money through the American Rescue Plan could also be allocated for this purpose. And again, we'll have to see how those dollars are allocated. The food and nutrition, addressing hunger and the food needs of children was in the forefront of our early days in the pandemic when the Juvenile Welfare Board assisted many of our partners and other community partners in providing food to families. The federal government has continued to assist in that realm as well. There has been an emergency allotment of $95 to the SNAP recipients, and the Biden administration actually tweaked that language in the American Rescue Plan for those folks who were at or near the maximum benefits. They're still eligible now to receive this $95. In previous stimulus plans, it cut them off from that access. So many families are now getting that additional $95 per month. It extends 15% of SNAP benefits through September of 2021. That's the 15% increase. And then the pandemic EBT for students in the early days of the pandemic when schools were closed, that was a very temporary opportunity for families to receive the funding on an additional electronic benefits card to pay for breakfast and lunch that they were probably getting at school but were not able to get at school because the schools were closed and they weren't eligible for it. So it has expanded that through the 2021 summer, and it's going to provide $375 per child per month. And that equates to $6.82 per child per day to purchase food. Now, as a mom of a 14-year-old who drinks a gallon of milk every 4 days, I can tell you that $6.82 per child doesn't go very far. So when you hear those numbers, I think it's important to kind of align them with what food cost. And that's really what the overarching goal now in the USDA is to align the allocation for SNAP and other nutrition benefits with the true cost of groceries, not some of those archaic 20-year formulas that they have been using to try to allocate benefits. Children's health legislation, there were a number of individual bills and then obviously individual allocations. There is significant mental health funding in the 21-22 General Appropriations Act, and it is mostly in community mental health, but there are other dollars in other places. There's $252 million in community mental health in various pockets of funding. There's also $120 million for schools for them to allocate mental health needs on school campuses. The Medicaid coverage for postpartum women was extended for that full year. And then the Office of Minority Health and Health Equity was funded at $9 million. That program had been stagnantly funded probably for the last 10 or 15 years at around $3 million. And with the pandemic and realizing that people of color have limited access and not a high comfortability level with accessing healthcare services, Senator Roussan actually spearheaded bringing this money in and enhancing it so that there can be some access impacts. Healthy Start and Healthy Families were both fully funded in the 2021 General Appropriations Act. And then unfortunately, there were a number of kid care bills. They all died in committee. We were hoping to make some of these changes this year to shore up, again, healthcare services for families who are not Medicaid eligible. And some of the reason why I think these bills didn't get traction is that a number of families, because of the pandemic, qualified for Medicaid. And so the roles of kid care have gone down while the roles of Medicaid have gone up. And the feeling was that kids are accessing health care just in a different vehicle. And that is all I have.
It was a busy session, and of course, all the work happens in the last few days, and
it does.
I know you were attentive to all of it. Any questions, comments? Okay. Thank you very much, Deb. It's a good summary of a lot of information. All right, Ms. Houghton, what do you have for us?
Well, we're well over time, so I will be very brief. Given the Governor's Executive Order 21-101, we are, we think, a governmental entity that falls under that. Chief Milliken indicated to me there's some question among special districts about whether or not they are or not. We are acting as if we are, which means that we cannot require any member of the public walking into our building to wear a mask. We can encourage that, and we do. The fact is, we're not a location where we have a lot of the public walking in and out. Our work is done via organizations that we fund, and they are face-to-face with the public. So we had to change our signage and change what was on the website and so on, and we've done that. With a high priority for the safety of our employees and the productivity of our employees, we're continuing to look at what our next phases will be in reopening the building and in how people will work. I would have to say and every organization is different, but I think what you heard before from many of our staff people would indicate they've been highly productive during this time. And I would say from the executive level, we see that from the managers, and the managers are telling us the same thing about the people working for them. It is a highly unusual group in that it is virtually all professional level people who really are passionate about their work. And to be honest, my greater concern has been that they create a good barrier in work-life balance, that frankly they're working more and they're working longer than maybe even is healthy. It's a little harder to, quote, shut the door, or you don't make the commute and have a break at the end of your day. So we have allowed any employees who want to work on site, and there are some whose homes are disruptive, or they've got the dog barking in the background, or their partner is working from home as well, and so on, that they would like to be back at work. And so we have made that change effective this week, that any employee can come back into the office should they choose to. And again, encouraging masks, but not requiring them. And June 1st, we will, in line with the governor's order, we will be open to the public. And so all that really means for us is we will have a receptionist and a way to get in touch with people, but we otherwise don't interface with the public here unless we create meetings that are here at this location. So more to come. We have surveyed our employees about their perceptions of both productivity and preference. We've conducted, I think we've now completed 3 different focus groups, 2 with rank and file employees and 1 with managers, but we won't get the information back or the major threads for maybe a week or so. So I and the executive group will look at that and make future decisions based on that, and we will talk to you. But we really are looking sort of at the 2 pieces, the safety and work-life balance and an appeal of working at JWB on the one hand, and assuring productivity and that we're getting our work done and we're serving the children and families that we're here to serve. And they're both important. Our first inclination is that we're going to get as much or more productivity if we also are flexible with our employees. So more to come, and we'll bring that back to you when we know more. Otherwise, the other issues we'll send you, I send out things at least once a month on updates on other things, and they can wait. But you've seen a lot of what we've all been working on here.
Thank you. Ms. Flynn, do we have any speakers? No cards for today. Okay, before we adjourn, Mr. Butler, we have a pretty good list there of anniversaries.
We do. First one is an employee that's been with us for 10 years, Jennifer Artiaga. And then we have another employee that's been with us for 8 years, and it's Felicia Pizzana. Then we go down to 7 years to Ann Crawford. And 5 years, Lorraine Hayes. 4 years, Joanne DeLernia. 1 year, Laura Kruger Brock. And 1 year, Willie Shaw. If we could just give him a hand of.
Yes.
That concludes that. Thank you.
It's hard to believe you're here a year, Laura. It feels, it's just amazing when I saw your name. So seeing no other business, I do want to make sure you make note of our upcoming board meetings. No board meeting in August, so if you just do a calendar repeat, make sure you take that one off. And I know we have a lot coming up with our finance and auditor selection. So the finance meetings are open to all board members, so if you want to make note of that. And having no other comments, concerns, questions, this meeting's adjourned.